Hello, my name is Dr. Murtaza Chishti. I am the Director, Heart, Lung and Vascular Surgery, Heart and Lung Transplant, Artemis Hospital, Sector 51, Gurgaon. Today I'll tell you about two most common diseases that affect the heart. The most common disease that affects the heart is that of coronary arteries. Basically, the vessels which supply blood to the heart often get diseased because of smoking, diabetes and high blood pressure, and lack of exercise and obesity. And when this happens, the heart can be endangered because there can be a heart attack, which means part of the muscle of the heart is damaged permanently, and the heart then becomes weak and can lead to failure. This disease is effectively treated by coronary artery bypass grafting, which means we use new arteries to bypass the obstructions in these coronary arteries. Most commonly, we use vessels which are called mammary arteries, which are on either side of the breastbone inside the chest. And we very carefully dissect them and use them to bypass the coronary arteries, which means the arteries of the heart. And these mammary arteries are the best conduits you can use because they are basically permanent solution to coronary artery bypass grafting. Sometimes we cannot use mammary arteries. In that case, then we use arteries from the arms called the radial arteries. And sometimes we also need vessels from the legs, which are the veins, which is generally not our preference, but they can have to be used sometimes. Coronary artery bypass grafting is basically a permanent solution for coronary artery disease and can be done with negligible complications and negligible risk of death. Even though this is a good and permanent solution for this problem, the patient still needs to modify his lifestyle, give up smoking, increase exercise as per the advice of the physician, and control his diabetes and hypertension very strictly, and use appropriate medicines, some of which are needed for the rest of their lives. And the second problem I would like to mention today is that of the valves. See, the heart is a pump. Its function is to pump blood around the body. It has got two main parts, the right side and the left side. The right side of the heart serves the lungs, sends the impure blood to the lungs, and the lungs purify that blood that comes to the left side of the heart, and the left side of the heart then supplies the blood to the whole body. Like any other pump, the heart cannot function without functioning valves. Basically, the valves must permit blood to flow without any obstruction strictly in one direction, and when it needed, they must open and close. Open so that though there is no obstruction to blood flow, and close so that the blood doesn't leak back. It keeps going in one direction. So there are two ways these valves can be affected. Either they become narrow and offer obstruction to blood flow, or they fail to close, which means they leak. In either way, we have to fix them if they are symptomatic and medicines don't work. For leaks, our first preference is to repair the valves. Repair has the advantage that it lasts long, and there is no need for blood thinners, generally speaking, for these patients. And patients' life expectancy is better. But sometimes repairs are not possible, so we have to replace these valves. And replacement is with artificial valves, which are broadly of two kinds. One is the mechanical valves, and other is tissue valves. Generally speaking, younger people, we prefer mechanical valves, and in older people, we prefer tissue valves. The advantage of tissue valves is that, generally speaking, they don't need blood thinners. But if someone has a mechanical valve, the patient must be on adequate blood thinner medicines for the rest of their lives. And again, valve surgery is done with minimal morbidity and mortality, meaning minimal complications and minimal risk of death. These patients, of course, need lifelong and close follow-up to make sure the complications are kept at bay, and the valve is observed for any further problems like leakage or blockages. And I want all of you to know that we are quite happy to respond to questions and queries to patients, clear any doubts, and elaborate more on any certain points. We can be contacted by phone or email address.